Well, that's Southern California in flames here. I'm heading over there actually next week. So I hope everything's going to be okay. But first, we're going to head out to the Mackinac Island coming up for a presentation with Dr. Ove Peters. This is going to be a point-counterpoint style on two specific topics of does obturation matter? And then the second topic is root canal therapy safe? Both of those are very important topics. So I'm looking forward to be a part of this presentation for the Michigan Association of Endodontists. Finally checked into the hotel and now getting ready to just have a drink and so on. Went and checked out the room. Room looks beautiful. So looking forward to this talk tomorrow. Well, I guess it's the day now. So heading out to the lecture room. Hopefully we'll get there on time and get this presentation going.
Also have some kind of dedicated obturation technique. I would say, but most of the time you don't see that.
Alrighty, well, this presentation's over. It was a wonderful discussion today in the morning with Dr. Ove Peters. By the way, these jackets here, this hotel, the Grand Hotel, it's a tie and jacket required after 5 p.m. to wear a jacket in this hotel. And it's a pretty nice, fancy, cool hotel, nice venue for this thing. But you know, I didn't have a jacket, so I kind of had to borrow a couple of jackets from the hotel. And I guess I'll be wearing hotel logo right on it. Okay, so the presentation today actually went very well. I mean, Dr. Ove Peters is just a classy guy. So we had a really nice discussion. It was supposed to be a debate. It was going to tout it out as though we're going to do a lot of controversial topics, but both of us pretty much agreed. We talked about obturation techniques and whether one technique is better than the other. And then we also talked about root canal safety. Of course, on the root canal obturation technique, the key really here is to understand we don't have any long-term longitudinal studies to state unequivocally whether one technique is superior to the others in terms of efficacy. All techniques are really dependent on the quality of the root canal cleaning and shaping and disinfection. My claim was that then, given the fact that the cleaning and shaping and disinfection is important, then the techniques for obturation should therefore be judged based on their efficiency rather than efficacy, because efficacy is really something that requires a lot of long-term research to prove. But given the same efficacy, perhaps we could use techniques that are a little more efficient so that we can benefit from the idea and the reality, frankly, that our patients have a limited time and capability of opening, staying open. Also, at the same time, we're constantly fighting our duration of pulpal anesthesia, which, as we know, is much shorter than tissue anesthesia. So with one carpule of xylocaine 1 in 100,000, you can only get about a 45-minute to maximum 60 minutes of pulpal anesthesia. So your techniques should be efficient so your patients don't end up having pain mid-operatively. And that's a key thing, as well as the limitations of patients. We're not working on mannequins. They can't stay open for extended periods of time, and you end up having more side effects with the TMD and their TMJ later on. So we need to kind of consider these factors and be more efficient. We also talked about root canal safety. Of course, as someone who's had root canals myself, as well as having done that on my family members and friends and everybody I know, I'm obviously a believer that root canals are very safe. Unfortunately, because of the media and because of this propagation of information, people get clickbaited into picking and basically clicking on a topic. A lot of these different websites, some alternative websites, if you will, some complementary alternative medicine websites, come up with these really exaggerated topics that causes the individual to click, basically clickbait on a topic, and then it'll take him to a website where they try to sell you products or services or basically get paid from advertising. And this is really part of the problem that exacerbates some of these disproven topics about root canal infections that have been first put forth by Dr. Weston Price. So I'm probably going to do a whole video and touch on this topic more because it's an important one, and increasingly because of the internet, more of our patients are now aware of these issues and this misinformation, disinformation campaign that has been put forth. If anything, for the time being, I can tell you to go visit AAE.org about root canal safety, and there is a number of documents to help support it. So be sure to go over there and check out that document. If anything, I may actually end up having a download link of the documents on our website that if you want, you can download directly from our website or go to the AAE.org and get it. Okay, so we're going to go downstairs and have a little social now because, you know, after the day's activities and the learning, we're going to now go down and do just a little bit of social, and then there's going to be another day or two of these courses coming up here for the Michigan Association of Endodontists. Oh, I guess before I go then, I just to quickly show you guys a case, the patient that came in for a follow-up last week that I just saw, and basically this is a tooth, as I was talking about the ability of the root canals to heal despite an overfill. This is a case that I did a year ago using hydraulic condensation. There was a puff of cement, and just a year later the tooth is obviously, for a lower molar, it's healing very well. It was asymptomatic, and you can see that despite the fact that I did get a fairly good size puff of the bioceramic cement, that the bone is coming back, and you can see on an angled radiograph that the fill, this is just basically a one cone hydraulic condensation, looks adequate, and so on.
I don't know what you're doing. Are you recording?
Here with Dr. Scott Sugars, who used to be my instructor back there at school at Northwestern. Scott, thanks for all the stuff you taught me. As a dental student and a resident.
Okay. This is the time now that you're going to start making it dynamic. So that's when I'm only focusing in one area. I can go back to that yellow box that we talked about.
The key here is about interpretation. That's the goal. But having proper acquisition and then proper image manipulation will help enhance your interpretation based on your knowledge base of pathology and all this stuff, and the clinical information you've gathered from the patient. I mean, this is what makes CBCT a very unique tool to be added to our armamentarium for proper diagnosis.
Absolutely. So, and then being able to see this in 3 dimensions, but most importantly, be able to be comfortable around this. That's the most important.
Hey folks, I'm here with Dr. Alan Law. Alan, thank you so much for that wonderful presentation. You mentioned the use of preoperative analgesics as a means of helping reduce some of the post-op pain, which Dr. Hartgreaves has done a lot of work on that area. You want to just kind of tell us what you use clinically, or what you recommend to use clinically right before a root canal?
My routine preemptive analgesic would be 600 milligrams of ibuprofen, 1 hour ideally prior to treatment.
Yeah. So what I was interesting also is that consuming enough water and standing.
Well, there are some recommendations for avoiding dyspepsia associated with the NSAID use, and the recommendations are to consume at least 240 milliliters of water, as well as staying upright for at least a half an hour after the ingestion of the NSAID to avoid some of the dyspepsia symptoms. And then you can look at whether the patient is taking an H2 blocker like cimetidine or ranitidine along with that to minimize dyspepsia if they have a history of dyspepsia.
Yeah, terrific. And of course the use of postoperative pain will help reduce some of the inflammation that is caused during the procedure and reduce the post-op pain, but also to manage and control the post-op pain. Also, according to the Oxford study, the recommendation.
Oxford League of Analgesic Efficacy looks at the number of patients you'd need to treat to get at least 50% pain relief, and at the top of the list is 800 milligrams of ibuprofen, which has been shown to be effective more so than a lot of medications like Tylenol with codeine. So that should be our go-to medication, would be an NSAID, and within the NSAID family, certainly ibuprofens have been shown to be very effective.
Yeah, reducing the use of morphine and morphine-derived analgesics, and opioid is obviously the best thing for the overall public health as well.
Right.
So, terrific. Well, as they say, all good things come to an end, and this wonderful weekend of presentations of Mackinac Island have now come to the end, and heading finally back home.